who are watching us now, what was the process like? Because what was the exam? I mean, or if you can say something, what is the exam? Good morning! Isang napakagandang umaga. Buenos dias! Bom dia! Guten Morgen! Buongiorno! This is your Filipino hamburger and welcome back to my channel. For today's video, we are joined by a good friend of... a friend, not a good friend. A friend of mine from Italy who is practicing medical doctor here in Hamburg, specializing in urology, right? Yeah. And for today's video, we are going to talk about how to become a medical doctor in Germany, especially if you are an international expat or you did your studium or medicine studium abroad. So, without further ado, let's welcome Dr. Andrea Mopa Marchete.
Thank you. Hi.
So, introduce yourself, Andrea.
Yeah, my name is Andrea. I studied medicine in Italy, in Siena.
Okay.
And then after 2 years in working in Florence, I decided to go abroad to do the specialization in urology, in this case the Weiterbildung. And I started a German course in Florence in 2012.
Okay.
Pretty difficult at the beginning, but I must say was nice to do it. I worked actually in Switzerland at the beginning, in the German part of Switzerland, near the German border in Constance. And after 5 years, then I decided to move to Germany.
Okay.
And now I've been working here in Hamburg since October 2020 in urology.
For those who are watching us now, what was the process like? Because you studied in Italy,
yeah,
and then you had your first few years as a medical doctor in Switzerland,
yeah,
and now you are here in Hamburg specializing in urology, right?
Yeah.
So can you bring us back to the first step that you had taken to be a medical doctor here in Hamburg?
Okay, the first step is you have to learn German. Of course, to work as a doctor, you have to talk to the patients. And first off, second, if you want to have job interview, you're gonna do that in German.
In German,
not in English.
Yeah.
And of course, if you can speak English, is something more for you. But
it's an advantage.
Yeah, it's not enough to get a job here, as everybody can understand.
Exactly.
Also, you have to translate all your documents, all your the diploma,
the university degree, certificates.
Yes.
Okay.
And everything you did in the university, you have to translate that in German. So anyway, you have to. The first step is you have to learn the language.
Okay, so that's the first step, learning the language, and then having your documents translated from, let's say, for example, in Andrea's case, from Italian to German. Right? And then after that, what was next?
Then what's next? Send your curriculum. So after you translate it, you have to send your curriculum to the hospitals where you would like to go to work.
Your application document.
Your application, yeah. If you get a job, then when you have the documents you need the documents from your boss, from your future boss, that he would like to give you a job.
Okay.
And then with that documents and all your documents, and a C1 German, you have to have a C1 level German, then you can apply to do special exam from the Ärztekammer in wherever you ask. In every every region of Germany has a main Ärztekammer. And there you have to do an exam that you need for the approbation, the Approbation, a document that says that you can work as a doctor.
Okay, so the exam is the Approbation, or is that
the Approbation is the entire process.
So it's
the processing of your documents, and then that you have a C1.
Okay.
They have to check basically that you studied somewhere medicine, and then that you are good at it. Because then after you get from your boss, from your future boss, you get this document that say we would like to give him a job.
A job.
Then you can do the exam of the approbation. Yeah. So if you pass this exam,
Okay.
then you get the approbation.
So basically, if I understood it correctly, approbation is sort of like having your documents, your degree recognized in Germany.
Yeah.
No? Because there are different educational system here, and of course, what you have studied in Italy or another part of the world may be different here in Germany. And so it has to be recognized through, or the entire process, like what Andre was saying, is called approbation. And then the approbation ends with an exam.
Yes, exactly that.
In German.
In German, yeah.
What was the exam? I mean, or
The
if you can
exam-
say something, what is the exam
In
like?
theory, they say this exam is just for German, but
German language, you mean?
that only German language. But it's not really that. They really want to see. They really want to check if you can work as a doctor, if you are good enough.
Okay.
They don't just check how you talk German or your grammar study. They want to see. They give you a clinical case. It's a proper medical exam. They give you a clinical case that you are supposed to pass in German, of course. But let's say if you don't do good the case as a doctor, even if you speak a super German, you're not gonna get the approbation. So it's both. It's medicine and German.
And German.
It's a proper exam.
They're assessing your knowledge with the language,
Exactly.
plus how deep is your knowledge with medicine in general.
Exactly.
Okay.
They want to be sure because they give you this approbation, so they are responsible for you in a way.
course.
You know, if you're not a good doctor, then they are also responsible because they say, you told us that the hospital can say, you told us he can work as a doctor, but he really cannot. So you are the commission of the approbation is also responsible for you as a doctor. So it's gonna be a proper medical exam in German.
Okay, when we talk about proper medical exam, is this a combination of oral and practical, or just one, or how?
It's just oral. I mean, there are 3 examinators. One is gonna act like a patient.
So okay.
It's gonna come to you and say, you have to act that you are the doctor and he's the patient. So you
It's like a consultation.
Yeah, a consultation.
Like for example, me, it's like, hey, Dr.
Say,
Marchetti.
hello, my name is Andrea Marchetti. I'm the doctor here. I'm responsible for you. And then you start the consultation. He's gonna act like he's gonna give you he's gonna tell you his problems, if he has pain, if he has fever, whatever. And he's gonna be the patient. The other one is gonna be your boss. Theoretically, it's gonna be your Oberarzt. So you're gonna be the Assistenzarzt, and the other one is gonna be the Oberarzt. The Oberarzt. On the third one is gonna actually be your examiner. And,
so like evaluating, assessing the entire situation.
How you do the anamnese and also how you talk, but how you act too. I mean, if you're nice,
the connection with the patient.
Exactly. If you're nice to the patient, or if you're giving him the
right advice,
and of course the right information,
right diagnosis, exactly.
She wants to know what's going on. You have to be nice and patient, and maybe one of them is gonna act like a bit nervous or aggressive, and you have to calm him down. They want to check everything. So
really a situational exam. And they play a certain role.
Exactly.
Particularly one of the examiners playing as a patient. And how long do you have to wait before you get the result?
Actually, that's pretty fast. It's gonna be.
Would they tell you right there and then? As I passed.
They told me basically right then that I passed. They told me you did really good. We don't think you did.
They told you that? You did really good.
Sorry. But normally it's gonna be 1 week, not more. I mean, Germans are really fast with documents. I must say, with bureaucracy, it's really good. So coming from Italy, I can say that it's a country that really works.
Okay. Going back to the entire process of approbation.
But I want to say that. Sorry, I
okay,
want to also say a part of this clinical part is going to be also a grammar part. So
grammar part.
More the grammar. They're going to give you a list of pathology in Old German. It's not just
Pathology.
It's not just medical German like the Umgangssprache. I mean the German the pathology names that old people used to use. So you have to learn this. So you have to memorize it more than learning. And the only way you're gonna do that is that, I mean, the advice that's really important for the exam is that you should come here before you do the exam and ask for internship, yeah, because then when you are here you're gonna get a lot of tips,
inputs, and you somehow see how the organization works.
Exactly.
And then from there it's like, okay, now I know how things work, and they can also provide you some information, insider that you might be
that you always need when you're preparing for an exam. I mean, everybody that went to the university knows about it. I mean, there are exams that maybe you studied 1 year on the wrong book, and somebody studied 2 weeks on the right book, and they pass the exam and you don't.
Yeah. Okay. So the entire approbation. How long was the entire approbation? Months, weeks, or years, or how was that?
I must say, it really depends on the region, on the
Bundesland.
Bundesland. For example, I had not really a pleasant experience in East Germany, where I asked for the approbation, and after 6 months they still didn't answer.
They never answered.
They never answered me actually. I had a job. I went to do the interview, and then I sent my documents to the Ärztekammer.
Yeah.
I'm not gonna say the name of the
no, let's just not say it.
But you know, I'm still waiting for an answer after a couple of years. And I must say, in Hamburg, where now I'm working, it was really fast. It was, I think, in 1 week I could organize all the documents, and they're really nice, and everything is explained really clear,
organized,
structured, and whatever you ask for, they're always there to help you.
That's good. No? Yeah, I mean, it's especially if you're a foreigner and you're clueless where to start. It's always important if the people from the bureaucratic department are helpful with the information they're providing you.
Yeah.
So bring me back again to that process. You got first the contract, and then your boss provided.
Not really the contract. They give you a paper where they say
you will have a position.
Once you give the approbation, we would
give you the contract.
We would give you the
So
job.
it's sort of like a bestätigung, a document confirming that this person X, Y, Z will have a potential position in our hospital if and only if he or she will pass the approbation, right?
Exactly. Yeah.
So you started the approbation, submitting your documents, and then you will be invited for the exam, or
exactly. I mean, this year was pretty difficult, I guess, because of the corona crisis. The office were closed for months.
Home office.
So I started the process in February
of 2020.
Yeah, then March was the apocalypse in Europe, so especially in my country. So everything was blocked till June, and then I got. I came here, got to do the exam in, if I remember, was June, end of June, and in July I got the job.
Yeah, and then
I started in the 1st of October.
So sort of like, it's a special case because of Corona, you know. It could be shorter.
Could be shorter.
It could be shorter, but like what Alvia said, due to the current situation that we have, things are longer than expected. Okay. You have to study German.
Yes.
C1.
C1. You need a C1 level.
Have your documents translated in German.
Yes.
Send it to your target employer.
Yes.
No, different hospitals, and then they will invite you for an interview.
Yes.
And then your employer will provide you a document for approbation.
If they like you.
If they Unfortunately, they like him. I don't know if it's a good decision or not, but yeah. And then this document you will send or show to the Erste Kammer.
Is that?
Oh, this is sort of like the Association of Doctors.
Of doctors,
right?
The Erste Kammer is
Erste Kammer.
that regulates the doctor life in
Germany.
Switzerland.
Yes, particularly in Hamburg, for example. And then they will invite you for an exam.
Exactly. You have to bring all the documents. They invite you for the exam. Then when you pass the exam,
Voila. You got it.
You got it.
And then you bring back the sort of Zeugnis to your employer. Hey, I
Exactly.
passed my Approbation.
once you have the approbation, you bring it to the hospital because they need it when you're not German
Yeah.
or when you didn't study in Germany. More correct.
So you
They
will,
needed that
Yeah.
because of for the contract. They need to have the
Yeah.
approbation. Not you. They cannot make you a contract.
yeah. So you will be recognized as a medical doctor, and you will be allowed to practice medicine, and then sign the contract and start the job. So basically, that's the process.
Yes.
Okay, great. So that's the first part of this conversation, like the process of becoming a doctor. If I could ask you one thing you like the most working in a German hospital, what is your main challenge working in a German hospital? How about the workload? The million-dollar question. Do doctors in Germany earn enough? Talking about colleagues, talking about bosses, how is it, or how's the hierarchy in the hospital? Is it strong, or I mean, do you feel that I am the boss, I am the head doctor, I am the general doctor here? What kind of tips would you like to tell them for them to easily integrate in a German hospital as a doctor? Switzerland pays more than Germany.
Yes.
Why suddenly, or why did you change? Why did you move here? What would you tell those aspiring international doctors who want to start a career here in Germany?